AIDS really devastated our community. I played on a gay softball team, and I was looking at a photograph of the 15 people on the team not long ago, and I can look at it and go, dead, 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 dead. So it really hit us hard. I started an organization to try and slow the spread of AIDS among some high-risk populations, street workers, sex workers, and intravenous drug users, the Richmond Street Outreach Project in 1987. There were two components to it. One was all volunteer. I would go out on the streets late at night, like 11 o'clock at night to 3 or 4 in the morning, to areas where prostitutes were hanging out. And I'd always have a volunteer with me. We give out condoms and lubricant and engage in discussions about safer sex practices. The other component was we just use employees. We hired people to go into what I considered much more dangerous neighborhoods to reach intravenous drug users that were not in treatment. And the people we hired had to be in recovery for at least a year, still connected to some type of a treatment program and still being monitored, undergoing drug testing. We got our first big grant was from the United States Conference of Mayors for $48,000. The mayor of Richmond, Jolene Williams, did not want it to happen. She tried to block it, but she wasn't successful. We then got a larger grant the next year from the State Health Department. But our first year, our first grant money, our first money came from the Survey Research Lab at VCU, because they wanted, they needed to do needs assessment surveys of all kinds of populations, and we were the only one reaching IV drug users and street prostitutes. So we did over 100 surveys of each of those populations, and I think it was 1988 or 89, I presented a workshop on those findings at the International Lesbian and Gay Health Conference and AIDS Forum.